I know many of you with health problems such as diabetes are feeling stuck and overwhelmed and basically struggling, worrying that things aren't going your way. But sometimes unexpected changes can actually be a blessing in disguise. And to demonstrate that, I'm going to share with you the story of a man, a 46-year-old diabetic man who lost his health insurance, unfortunately, but was able to make a remarkable turnaround in his health. So if you want to be inspired today to take your health to the next level, you're going to want to listen to this story. Before we get into it, I'm Dr. Amina, Goodwin, a physician and a health coach, and I help you get your blood sugar levels normal and keep them there without deprivation. And this is so that you can have great energy throughout the day, so that you can banish food cravings and avoid weight gain, especially as you grow older, and so that you can live an overall longer, healthier life. All right, we're going to get into the video. I'm going to share with you this young man's story, and then we're going to talk about some lessons, 8 lessons that you can learn from his story and utilize in your life going forward to get better health. All right, so let's get into it. So this is a man I met recently as a patient, 46-year-old man who's diagnosed with diabetes about 10 years ago. After his diagnosis, of course, he was put on different medications. He was diagnosed with type 2 diabetes, started off with pills, and then soon after he got started on insulin, and his blood sugar levels remained high, and he got prescribed more insulin and more insulin. He just kept gaining weight, and his blood sugar levels stayed consistently over 300. He just could not get his sugar levels normal. Throughout this, he would feel sluggish on and off, and just not the healthy 46-year-old person that he was, right, coming over the years. Fast forward to about 7 months ago, he lost his health insurance. And when he lost his health insurance, unfortunately, he was no longer able to afford the medications that his doctor was prescribing. He was taking medications, tablets for diabetes. Also, he was taking a lot of insulin. He was taking cholesterol medicines, blood pressure medicines. For those of you who take insulin or medicines in general, you know that it can get quite costly the more medicines you're on. And insulin particularly is quite an expensive drug. In addition to insulin, you have to get syringes and so on and so forth. So it's definitely not cheap. When this man could no longer get his medicines, he realized, oh, either I'm going to die soon or I have to make some changes to keep myself alive without having to rely on medications. And obviously, he chose the latter path, basically decided to learn what he was able to do or what he could do, right, in terms of his diet and lifestyle, so that he can get his blood sugar levels normal, keep them normal without having to worry about the fact that he could not afford medications. First thing he did was he hit the internet. He decided to do some research how to manage his diabetes naturally without medications. And he came upon a doctor who had videos on YouTube, and he dived into the videos from that doctor about natural management of diabetes. And he fortunately found someone who explained things to him. They explained how his body worked. They explained what made the blood sugar high. And he decided to adopt what this doctor recommended, which was a carnivore diet. Now, I don't recommend diets in general, as many of you know, having listened to me, but there are many diets out there, and everyone is free to choose the diet that works for them. Ultimately, the diet that's best for you is the one that you can follow. So this man decided to choose the carnivore diet, which consisted, for him, I asked him, what does this mean? Because everybody's definition is different. For him, this meant that he was eating mostly protein and fat, and he said he gave up starches and he gave up sugars, and he did that consistently. He made the decision to do this because he realized that to keep his sugar normal, he had to stop taking in sugar because his body was not able to handle it. He saw that there were improvements in his blood sugar levels. Essentially, they went down, 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 and whereas he struggled for almost 10 years to get his sugar below 300, he now got gradual improvements in his blood sugar to the point where now, 7 months later, his blood sugar is consistently under 140. In fact, he says his blood sugar ranges from about 100 to 130. It almost never goes up to more than 130. Now, excuse me. In the process, excuse me, of trying to figure out his blood sugar and control of his diabetes, he realized that he probably had insulin resistance, which actually is the cornerstone of type 2 diabetes. That is the underlying factor where the insulin does not work well, which is why you have to take more and more insulin as prescribed by your doctor. So he realized that, oh, insulin resistance is the problem. Taking insulin is going to make it worse, because it does, right? And then he also learned that, oh, the metformin that I was on, that actually helps insulin resistance. It helps to reverse insulin resistance in the body. So he made an educated decision, because he did educate himself. He made an educated decision to continue taking metformin. And fortunately, metformin is one of the oldest drugs we have for diabetes. And because it's an old drug, it is way more affordable than many of the newer drugs. It happens to be, I like metformin as for me, it's the best diabetes drug for a type 2 diabetic. And so he continued to take metformin, but because it's old and cheaper, he was able to afford to buy it cash, right? Oftentimes, by the way, the cash price of medicines is way lower than the price that you get, your insurance is charged if you have insurance. So he educated himself, continued to take metformin, and he continued to keep or eliminate starches and sugars from his diet and focus on protein and fat for his energy and nutritional needs. You might have watched some of my videos before, and you know that the body is able to manufacture, make from scratch glucose. If we never take another bite or drink of glucose in our lives, we're not going to die, because our bodies are able to manufacture glucose. So that is what he did. He continued to learn, and over a period of several months, 7 months to date, he says he was able to lose 50 pounds. He lost 50 pounds, and over this course as well, he was able to get his triglyceride level. Triglyceride is one of the bad types of cholesterol. It's what basically oozes out of the liver and fat cells when you take in too much glucose, and the glucose is transferred or made, basically used to make triglycerides for storage. So when you have a lot of glucose in your system, you end up making lots of fat and triglycerides. And he was able to bring his triglyceride level down from more than 450, he was so proud of this, down to 100. So high triglycerides, one of the hallmarks of metabolic syndrome, insulin resistance, type 2 diabetes, which is uncontrolled. He got his down from 450 to 100 over this 7-month period. Overall, he feels better, he feels stronger. The reason I met him is because he came into the hospital with a foot infection. Unfortunately, he damaged his foot while doing some work around the yard, and his toe rather. And in trying to take care of that toe and bandage it, he unfortunately sort of squeezed his foot too tight and ended up traumatizing the other toes on the foot. And so he came into the hospital with a bad foot infection, went to the bone, some infection went into his bloodstream, and unfortunately throughout the course of that, he lost the toes. Now, did that set him back? Did that make him think, oh well, why did I do all this work so hard to get my sugar under control, and now I ended up losing some toes on one of my feet, on one of my 2 feet? Did that make him feel like, oh my goodness, this is for nothing, let me forget about it? No, he did not, because he realized, okay, I lost some toes, but if I didn't make any of these changes, I would probably have lost my life. So he didn't give up, as many people do, give up and say, this is not worth it because I still lost my toes. He is still pushing forward, thankful for life, thankful for the fact that he actually still has his foot. He didn't even lose his foot, okay? And he's pushing forward. And now he is planning to, the next stage of this for him is to start lifting weights and start building his muscle mass. So he said, yes, he lost some weight, and now he's ready now to take it to the next level and build up some muscle to help with his metabolism, help increase his metabolism, his metabolic rate. So this man has learned a lot. He found somebody on the internet, and he's making positive changes to put his health in the direction that he wants it to go in. What can you learn from what this man did? 8 things quickly that you can learn, 8 lessons that you can learn from what this 46-year-old man did to turn his health around, turn his diabetes around, all after losing his health insurance, which would be the nail in the coffin for some people, right? 1, he took action. He took matters into his own hand instead of becoming a victim. He avoided victim mentality. 2, he found a mentor. So a lot of times people think, well, I can't afford to pay somebody to teach me. I can't afford, a coach or a mentor. He didn't let that keep him back. He went online. There's everything available online for you to learn for free, right? And so that is what he did. He searched and searched until he came up with someone who he could understand. They explained things in a way he could understand, and he took it to heart and kept learning, and he is still learning. 3rd thing he did is that, he learned, as a part of what he learned exactly about his disease, type 2 diabetes. So he didn't just, a lot of times people okay, you have a disease and that's it, you do everything the doctor tells you, and they never learn what it is this disease is, what they might be doing that makes it worse, what they can do to make it better. This man went out of his way to learn and understand his disease, because he realized knowledge is power. So with his knowledge, he had the power to do what he needed to do to take things in the right direction, right? 4, he was very thoughtful. So he didn't just memorize what he learned, and he understood, and he made an educated decision to actually continue to take metformin. So yes, insulin, blood pressure medicines, cholesterol medicines, I can't afford to take all these things. Which one is important? And so he decided, I'm going to take metformin, because that's going to get to the root of the problem, the root cause of type 2 diabetes, which is insulin resistance. And I'm going to help my body to fight this insulin resistance. So I will take metformin. 5th thing is that his health improved essentially, fifth lesson is that look at how quickly his health improved. In 7 months, he got his sugar down from over 300 to under 130. He got his cholesterol from 450 to 100. He got his weight down by 50 pounds. He did that in 7 months, things that he was struggling for 10 years to do. So you see how quickly diet and lifestyle changes help compared to medications, which are basically a band-aid on the whole problem. Excuse me. Fifth thing he learned is that, fifth lesson is that you don't give up just because of one setback. So yes, he had a foot infection, but he's not letting that keep him back. He's still pushing forward. Never give up. When you give up is when you die, okay? Sixth thing is that he did not, if you notice, this man did not go and make all the changes all at once. So some people, they say, you know, I'm gonna change my diet, I'm gonna go to the gym, I'm gonna exercise, you know, I'm gonna go organic, I'm gonna go gluten-free, and they choose 5, 6 different things that they're gonna do all at once. They overwhelm themselves. They fail because nobody can make so many changes all at once unless you're a super person, and then they go back to square one. They say this doesn't work, right? This man, step by step, methodologically, is making his changes. The first thing he focused on, give up sugar and starch, and now he's gonna get ready to build his muscle, go to the gym or lift weights, and not necessarily the gym, you don't have to go to the gym to lift weights, but he's going to lift weights and build his muscle. So one by one you make changes rather than all at once, which may be overwhelming. And the seventh thing, and maybe the most important, is that this man has adopted a positive mindset. What is mindset? Mindset essentially is where you set your mind, what you put in your mind, what you do not first see in your mind, like how you have to see in your mind yourself how you want it to be before you can take action to get there, right? And that is mindset, where you set your mind to. So he set his mind to a healthy version of himself, to the type of person who can do the things necessary to get to the health that he wants to have, okay? Positive mindset, that is what he adopted, okay? So I hope you all found this video very inspiring. It's possible. Like, our bodies are designed to heal themselves, to be healthy and to maintain health, but we have to help our bodies to do what they are designed to do. We have to adopt a positive mindset. We have to believe that we can do it, and you can do it. If this man could do it, you can too. I believe in you. I hope you continue to, you know, push through, not give up hope. And if you found this video helpful, definitely go ahead and share it with somebody who you think might benefit from it. If you've personally had a story where you helped yourself to get a positive change in your health without medications, you can feel free to share that with us as well, and help inspire others who might need some inspiration today to get their health better. Thank you for watching, and I will see you on the next video. Have a great day. Bye.